Hello, everyone. My name is Cameron. Today I'm here with Dr. Chris Cormier. We're going to be talking about endometriosis, being that March is also Awareness Month for endometriosis. Hello, Dr. Cormier.
Hey, Cameron.
For someone who is newly diagnosed with endometriosis, can you explain what is actually going on in their body?
Yeah, so basically, in a female's body, if you think about it, every time they have a cycle each month, there are endometrial cells that are inside of the uterus. And those endometrial cells kind of grow and then they debilitate and basically turn into the cycle, into the blood coming out. And so, what ends up happening to certain females is those endometrial cells, instead of just being inside of the uterus, they grow outside of the uterus and they can grow in different parts of the body and cause all kinds of problems.
It's often described as tissue growing where it shouldn't be. From a nervous system perspective, what is your story on that?
Okay, so remember cells in the body, you have 30 trillion cells roughly, which is a crazy number to think about. I mean, 30 trillion cells. Each cell has all these different responsibilities and each cell has senses and the brain is wired to all these cells, which is crazy to think about that. And your brain is should be in understanding of something called proprioception. It's one of our senses. Proprioception is your sense of time and space. So, in other words, your liver is located here. Your liver cells should be here. You shouldn't have liver cells here and then liver cells over here. Um, and that's what ends up happening with this particular condition is some of those cells in the uterus, those endometrial cells, they actually lose the sense of proprioception and they start growing somewhere else where they shouldn't be growing.
Is it just a reproductive issue or is it more of a whole body issue?
Well, you think about it, it can certainly affect the ability to reproduce, but it also can have many other side effects, right? You can just live your life with a ton of pain. Some people who have this condition have had multiple surgeries for it, and sometimes they're not any better. And basically, just the misery of not having those cells where they should be and doing what they should do every month can cause all kinds of problems throughout the body.
Do you know any specific symptoms that some women may have with endometriosis?
Just pain. A lot of them. There's so many symptoms you can have. First and foremost, it can, but pain could be something. Irregular cycles where the body's not bleeding like it should and not having the regular cycles that it should. It could be other symptoms like they just don't feel good at all throughout here. So some will put on weight. Some will just not feel good. The hormone production can be bad. And there's all kinds of things that can start to trickle in the body if you don't take care of this particular condition.
Why may some women have certain symptoms, but another woman can have completely different symptoms with the same label of
It
endometriosis?
just depends, right? So every condition in the body, like endometriosis, it can affect a woman like you a certain way and another woman a different way. It depends on where those endometrial cells have grown outside of the uterus. It depends on what they're doing outside of the uterus. It depends on the hormone problems associated with all that. It also it's so many other causes, right? A woman could be using a non-organic tampon. They could start the whole process and they're not even aware of it. So there could be a lot of different ways this condition could start, but you want to think of it as something offsets those cells in that uterus. There's got to be either one thing or multiple things that could offset the health in those cells and alter that proprioception. And certainly it could be genetic as well. So you got genetics coming, but then you also have physical stresses, emotional stresses, and environmental stresses that can affect this. A lot of women also have pain during sex with this as well, which is not a normal thing.
Yeah.
So again, it's just that section of the body should be functioning, but unfortunately, it's not with this particular condition.
You have your clinic, the Nerve Health Institute. Without going into any personal details or private details, could you tell us of any woman that has come to the clinic with endometriosis and how she is now and how treatment here has helped her?
So basically, yes. From our perspective, we're trying to keep things connected. And so imagine here, your brain, you have input through every cell and you have output to cells. And so for those maybe tech people, it's called sensory in and motor out. And so basically every cell, when those cells start to lose this sense, they start to have dysfunction. And so the women that we've been able to work with this sort of condition, we're able to reconnect those cells to try to make sure that the uterus has the right cells. Those endometrial cells are in the uterus and not necessarily spread throughout the body wherever they're going to go. So those types of patients we've been able to work with, it's all about reconnecting the brain to those cells. Also keep in mind, with this particular condition, we've had some patients that they come to us so bad they need surgery for it because these growths can get bad, in the uterus, outside of the uterus, all over. And so, but the sooner we deal with this, the better. And even if it has been failed surgeries, whatever, for this condition, we've been able to help a lot of women just to reconnect the cells through the brain, get those cells healthier so that they don't have these types of problems.
Amazing. How important is it for these patients to have consistency with what they're doing to better their overall self-healing?
So we talk about the different types of stress that affect cells in the body. So remember, you have environmental stress, which is crazy nowadays. I mean, you have everything from chemicals to pollutants to additives, preservatives. We have 5G Wi-Fi. When it comes to this particular condition, maybe they're using artificial things. Maybe they're taking in all kinds of endocrine disrupting chemicals, which could be from soaps, it could be from shampoos, it could be from makeup, it could be from foods, drinks. And there's so much disrupting hormone production in the body. And that could be a part of a factor relating to this sort of stuff happening in the uterus. So with these cases, it's crucial that we individualize each woman coming through and try to isolate which things are potentially causing these cells to stay abnormal, and then try to fix whatever those are, whether it's changing a habit they're doing or actually strengthening their nervous system and their cells to what's potentially happening in their day-to-day routine.
You talk about the OWL method. If you would like to go through that little method for us real quick, what is the OWL method?
Yeah, so basically when it comes to cells in your body, regardless of whether they're uterus cells, there's cells throughout your body. The number one elemental ingredient in a human being is oxygen gas. It's a non-arguable scientific fact. So these cells basically should be 65% oxygen. When they start to lose their oxygenation, they get sick, they get diseased. So we have all kinds of oxygen devices to replenish oxygen to cells. Second would be water. So you want every cell in your body to be hydrated properly. If it's not hydrated properly, then it can have problems. And we want not only is quantity important with water, but also the quality of the water. So we have ways of helping with that. Then light energy is like the fiber optic power from the brain. So imagine just uterus cells in a woman. You want all those cells to be connected to the brain. You don't want power outages. Just pretend your brain is like a power company and it's powering up trillions of houses. And so it's impossible in today's world to keep your brain 100% powered up to every single cell in your body. And so we want to do a good job of trying to keep that brain in all of our patients. I always say at least 85% connected to all the cells so that bad things don't happen with those cells. There's also other ingredients, not only oxygen, water, light, which we call OWL, but there's frequency and there's magnetism. And then there's nutrients. There's all these really, really important factors that so many times people start with nutrients, but they miss all those other primary ingredients first.
Let's talk about the frequency. I think that a lot of times people are a little bit confused on what you mean by frequency because they don't know how frequency is in the body. Would you care to explain that?
Sure. The cells in the uterus have a different frequency or tune or guitar string tune than the cells in your heart, than the cells in the ovaries, than the cells in the kneecap. Every cell in the body has its own resonant tune or frequency. And unfortunately, the world that we're living in, has so many interfering factors that actually offset the radio frequency or the tune of a cell. Wow. And the more that frequency or guitar string gets lost in a certain group of cells, then those cells can't perform. They can't do their job. And maybe they get altered and they get weird and do weird things. So with frequency, we have devices nowadays that you can literally put in your pocket to help reset particular cells in the body. So there are cells like this device we have here. you can use for home. We've had to do this with our patients because it wasn't just good enough to have all these things at the Nerve Health Institute. I wanted to help people 24/7. I can't go with every patient. So we had to really figure out how to help them at home. And that's what we invented. We have Nerve Health Institute for the clinic. We have Body Charters for home. And Body Charters is our full platform for teaching people how to self-heal at home and maximize their self-healing. And it has all these types of things like these devices. There's settings for females or males in here, and all kinds of settings for organs and glands that you can help to reset cells in the body that have lost their frequency.
Wow. So we're talking a lot about resetting cells, giving them the ingredients that they need. How do you find which cells need ingredients?
Yeah, so basically, from our perspective, on a new patient visit, people coming to see us, we go through an 88 nerve check, and so the brain is here, the spinal cord runs all the way down. There's 88 primary nerves. There's 44 pair of nerves. They start as big power lines, and those big power lines branch into all the trillions of cells you have. So you can imagine there's just tons, trillions of nerves in the body. So we start originally when people come to see us by going through all those 88 nerves, figuring out exactly which nerves are disconnected so that the brain can start to reconnect those. And oftentimes in women, what we find with this particular condition, the ovaries a lot of times are disconnected. Even, the OB-GYNs over time will tell the patients that they have, the women patients, yeah, your ovaries are just probably going to die over time, because literally the power supply loses power to the ovaries, and of course they just die. So the same thing, we want to keep the brain and ovaries connected. We want to keep the brain and the uterus connected. We want to keep the brain and the pancreas, all these endocrine glands in a woman's body, the thymus, the thyroid, the pituitary, the hypothalamus. We want to keep all these endocrine glands properly connected so that hormone production can be on demand, so that the body can actually do all of its things it's supposed to do. Something else to keep in mind, a lot of women have also had parts removed sometimes when they come to see us. Maybe it's an ovary removed. So we have ways of getting around and helping with all those different things.
Amazing. To talk about the at-home platform that you talked about, Body Chargers by Dr. Chris, how could that help women with endometriosis?
So basically, just to clarify, we don't, with Body Chargers by Dr. Chris, we don't treat medical conditions. It's not designed to become a doctor at home. It's designed to give self-healing instructions. Remember, our bodies are designed by God to heal themselves. And Big Pharma doesn't want you to know that. And there's some factors you have to do, like we talk about with, oxygen, water, light, frequency, magnetism. So nutrients, all those strategies that would be used for home to help maintain your amazing body can be done in the Body Chargers platform. And there's so many suggestions for those out there. It's a monthly membership or a yearly membership. It's only $42 a month. You can try it. There's so much information in there. It's all systematic. It's easy. Once you get in there, you don't have to spend any more money if you don't want. You don't have to buy extra devices if you don't want. We have all these suggestions that will dramatically change your life if you're focused on those basic ingredients and getting them back. But if you want to take things higher, we have all kinds of suggestions where you can do once you're in the platform to get the highest level care at home so that you can help yourself.
A lot of women are told that this condition cannot be healed. What would be your response to something like that?
So just about in the human body, remember, it's literally designed to heal itself. So just pretend like endometriosis is a cut that's not healing. So if that cut's not healing, you have to do the right things. Yeah. Otherwise, you might have that cut forever. Otherwise, genetically speaking, if you don't do your best to get rid of it, then it'll just keep carrying forward into generation after generation after generation in your family, potentially worse than what you had it. So my take on it is to do the absolute best in your life to overcome the bad genetics you have, to overcome the bad stresses that affect those cells, causing particular conditions, and maximize your body's ability to heal itself.
Amazing. Have you seen women that are regain their strength and energy and quality of life after really starting to work through their nervous system deregulation that they're having?
We see it all the time, where people come to us, especially women. Usually women that come with endometriosis, they don't come with just endometriosis. There's a lot of other things they come with, where, you know, when that cycle's been off, when that uterus has been off for a long time, it offsets all kinds of other things throughout the body. They may have chronic fatigue, they may have headaches, they may have fibromyalgia, they may have autoimmune conditions, other autoimmune conditions, and it's something so important. Once they come to see us, it's the most beautiful thing you've ever seen, where you can see lights come back on and their health go back up, and basically they start to enjoy their life again, where they can do all the things they wanted to do that they couldn't do before, when it comes to this particular condition. So it's something, again, that I can't impress upon people enough. The world we're in right now is filled with more endocrine disrupting chemicals than we've ever had in history. So that factor alone is influencing the health of so many of your cells, especially if you're a female. I mean, these cells are so important for day-to-day activity, just your overall mood, right? Everything in your body is influenced by these glands and the connections that you have to all these cells.
I'm sure we're going to have some people watching that do have endometriosis, or have a family or friends or someone they love that have it as well. Is there any hopeful message that you would like to send out to them?
Yes. I always want to teach people that this body we have is miraculously designed to heal itself. It's called self-healing, but you got to do the right things. And so if you're out there struggling and you've not been successful or had the results that you want, we're this beautiful portal for you, where we're going to offer certain things to you you've never had done before. And we're going to do it in a way that's all natural. And it's literally, I always tell people, we're not responsible for healing anything here. Your body is. And so God designed this amazing body. It has the full potential to heal. This is like a cut that won't heal. You got to do the right things.
Yes. Well, thank you very much, Dr. Cormier. And thank you guys for watching.
Thank you, Cameron.
If you can relate to what we talked about in this podcast, then subscribe to our channel and like this video, as it really helps the algorithm. Don't forget, if you want to help yourself with self-healing at home right now, then simply become a Body Chargers by Dr. Chris member. And remember, our clinic, the Nerve Health Institute, is open all year round for in-person visits. For more information, just click the link below.